So unique about our PGY2 program and our ambulatory care program is the support we have, and then also being able to work at the top of your licensure as an ambulatory care pharmacist.
Here at JPS, they really push pharmacists to be as advanced as possible, so we're able to initiate, start, stop, modify therapy. We're also looked at as pharmacotherapy experts. I think being able to really work at the top of our license is a true highlight of the program.
This field is growing, and it continues to grow even within our organization because they have seen that our need is there and our patient impact is there. When you come here, you'll be able to not only manage the patient in the chronic disease states that they have, but you'll also be able to learn how to overcome barriers that these patients have, whether it's income barriers, language barriers, health literacy. We go beyond just the chronic disease state management, and because of that, this is a unique place to work for, and it offers unique experiences.
Patients with HIV, their medications are very expensive. It can be about $3,000 to $4,000 per month, so it's not as easy to access different services. It's not easy to get their medications from the pharmacy, so being able to think outside the box to be able to help our patients reach their healthcare goals.
Having the opportunity to see patients from different walks of life, different backgrounds, races, religions, it really expands how you communicate with patients, how you consider their care, the different things that you may do to meet their needs based on where they're at.
I've built on my skills with Spanish speaking to accommodate for those cultural needs of patients who might not be able to speak as fluently. And we do use interpretation as well, but I think with going that extra step to learning simple phrases in Spanish or in their language and kind of having that communicated with the patient, that builds the relationship that the patients look for. And knowing that not only do I care just about their health, but I care about them as a person and being able to be open to their cultural differences.
When I first came to JPS, one of the things that shocked me or I was initially surprised about was how integrated pharmacists were into the outpatient clinic setting. The clinics are set up in a very diverse, interdisciplinary environment, so having the opportunity to talk directly to nurse practitioners, send them messages about mutual patients, get their insight on things that I may be confused about, everyone within the team is willing to learn from each other.
So if I have a question about a patient, I can easily message any of my coworkers so that we are all on the same page with our patient. On the flip side, if any of our physicians or mid-levels have questions about medications, drug-drug interactions, I make myself available so that I can be there to answer those questions, because at the end of the day, we all want the same thing, and that's to improve patient health.
So the culture of learning is ongoing, so it's never something that's stopping, it's always continuous, and it's always embedded into different experiences within the program, which is a good thing because you always feel like you're gaining something each day.
The teaching opportunities the residents are able to take a part of is, one, we have family medicine residents here at JPS. We have a huge program. So they're able to give didactic lectures, but yet interactive lectures to our first year residents about diabetes, also asthma. We're able to collaborate with UNT, so they're able to do teaching for our P3 students at UNT through a pharmacotherapy lab.
We want to make sure any resident that comes here can leave our residency program and immediately run into their own ambulatory care program. And then from that, being able to provide that optimal patient care and understanding how do you collaborate with other professions, mid-levels, nurse practitioners, MAs, and physicians.
One of the things that I really like about the program is their level of flexibility. So if you have particular interests or you want to see other experiences, the preceptors here are really good with working with you and working with other departments to make sure that your learning needs are met so you don't walk away feeling that you missed out on something.
So the diversity or exposure throughout the rotation includes working primarily in an HIV clinic. And on top of that, I do practice at our correctional health facility, so our county jail. So residents are able to see and interact with patients living with HIV in that setting as well.
We have our chronic disease state management. That's your diabetes, hypertension, anti-coag, and asthma. We also have experiences in homeless clinic and my clinic cardiology, where we work closely with our cardiologists, our mid-levels, seeing procedures like cardiac ablations and device implants, so that we do offer our resident a well-rounded experience.
The culture here at JPS is very unique. They really do celebrate everybody, all the patients. They celebrate all of our employees here.
We have mentorship to kind of guide us throughout the residency year. My mentor that I chose was able to kind of help with any sort of stressors that were going on throughout the year. So I felt very championed
With the preceptors here, the relationship is really open and transparent. I think they're very approachable, and one of the good things with the preceptors here is all of them are also residency trained, so they know what it's like to be in my shoes, so they can see things from my perspective as well.
I try to be really relatable to them, ask them about their personal life. Even though I may not be their mentor on record, I still like to serve as a mentor for the residents.
JPS recently was awarded America's #1 hospital, I believe, by Washington Magazine. So I think that's just a testament to what they're doing in the community at large. I definitely feel like coming into work, I feel like I'm having a purpose here. So I can definitely see why that award was given to them.
One of the recent accolades within the rotation is that the expansion of clinical pharmacy services within our HIV clinic. We also have a behavioral health or psychiatry clinical pharmacist. We also have a general infectious diseases pharmacist that's able to serve OPAD and also outpatient antimicrobial stewardship. And then lastly, we're able to embed a CDM or chronic disease state management pharmacist within our clinic so they can able to see primary care services for our patients living with HIV.
JPS allows you to live out your passion unrestricted. So they allow you to grow into the pharmacist that you envision yourself becoming. And for that reason, I think that this program is pretty unmatched.